Hi, my name is Travis Goodman. I'm a licensed marriage and family therapist, and today we're going to do a quick overview of what bipolar 1 disorder is. We're going to look at the signs and the symptoms, i.e. the criteria, along with the treatment of it. So come on, let's get started. So first and foremost, let's talk about the prevalence of bipolar 1 just in the US. It's roughly about 2.8% of the population, which is actually about 4 times less than depression. Major depression is about 10% or so of the general US population, which is quite significant. And between men and women, there isn't really significant difference. It's sitting around 2.8, 2.9% respectively. So now let's jump into the signs and the symptoms, i.e. the criteria that I use or that we use to diagnose bipolar 1 disorder. So let's go. So first and foremost, bipolar 1 disorder requires that the individual has what's called a manic episode. And that is part of the initial requirement of being diagnosed. And what a manic episode is a distinct period of abnormally or persistent elevated, expansive, or irritable mood, and abnormally and persistently increased goal-directed activity or energy. And again, lasting at least a week, if not more, present most of the day. The second part is during this period of a mood disturbance or increased energy or activity, there's 3 or more of these upcoming symptoms, and 4 if the mood is only irritable. So let's go ahead and jump into these 7. Number 1, an inflated self-esteem or grandiosity. Number 2, a decreased need for sleep. An example would be maybe someone's feeling rested after sleeping 2 or 3 hours, but having all this energy. Number 3, they are more talkative than usual, or kind of this pressure to keep talking. Maybe they're hyperverbal is another term, where they just keep talking and talking and talking, almost like you can't get a word in, again, which is quite different than their typical behavior. Number 4, they might have what's called a flight of ideas or subjective experience, like thoughts racing. And flight of ideas meaning they're ping-ponging around from all these maybe things they want to create or business ideas, things like that, kind of bouncing around. Number 5, highly distracted, really easily to distract, and they're kind of easily drawn to things that are irrelevant, unimportant. Your friends can see it. People will observe this. Number 6, there's an increase in kind of goal-directed activity. This could be related to work or school or socially, or even people can act out sexually or maybe act out in some other activities. And finally, number 7, there can be an excessive involvement in activities that have a high potential for painful consequences. So some examples of that would be going and spending $30,000 or $300,000 on something you don't have the money for, or maybe having foolish business investments, kind of investing in a bunch of things that really you have no interest in following through later. So these are the 7 kind of main criteria that must be met. And again, 3 or 4 if it's only irritability. And the next part of diagnosing a manic episode is that this mood disturbance is sufficiently severe to cause a marked impairment in a social or occupational functioning, or it can necessitate immediate hospitalization to prevent harm of self or others, because there's possible what's called psychotic features. So, and this episode is not attributable to other things like a substance abuse, like alcohol or other drugs, like an amphetamine. Now, people with bipolar 1 can also have and go into a major depressive episode following, but not always. So people with bipolar 1, they have to have a severe manic episode, and they will not necessarily have, again, a depressive episode. They might, but it's not required to have the diagnosis. That's something that we'll talk about maybe in another recording later about bipolar 2. So now let's jump into the treatment for bipolar disorder. What we know based on research is really it's best addressed by 2 things, both medication and psychotherapy. Now let's talk about medication. So not everyone is going to require medication for long term. Some people require it for short term, or maybe only during their kind of manic episodes or depressive episodes. And there's various medications out there like antipsychotic, mood stabilizers, antidepressants, anti-anxiety medications, or a combination. And often this individual will work with a trained physician, a psychiatrist, to help manage the medications to best treat the individual's particular context. And number 2, psychotherapies. And that's going to come from an array of different modalities to help the individual. Things like mindfulness-based cognitive therapy, or just mindfulness techniques, deep breathing and grounding techniques, building on an awareness of kind of mind, body, and soul, which is often coming from mindfulness practices, helping the individual become aware of, are they kind of coming into a manic state, to kind of catch the signs and symptoms. People use, again, an array of other modalities too to help treat, to equip the individual really around awareness and skills to manage along along with the medication. Something else that we have found to be helpful that I've even used with some of the people that I've worked with that are struggling and have bipolar disorder are different ways of tracking their mood. And actually there's some really good apps out there. And I don't get any money for this. And some of the apps that I like, that have great reviews, that I've even kind of played with and I've had some of my clients use are these kind of few that stand out to me. It's eMoods, Dailyo, iMood Journal, T2 Mood Tracker, and there are other ones out there. But those are just some of the ones that I've seen. I've had some of my clients use. I've also kind of played around with them and they tend to be pretty good. They're very similar. They have some slight differences, but they're really good with kind of overall tracking to really help the individual become aware of their moods. Are they heading into a manic state? Are they kind of beginning to dive into a depressive state? And that's really important because it's helpful for the individual to kind of know where their body's heading so they can best take care of themselves, whether it's, adjusting medication, whether it's getting back into therapy, looking at their diet, looking at their kind of holistic health. And I really hope you found this helpful and educational. This is, again, a quick overview of what bipolar 1 disorder is, some of the prevalence, the signs, the symptoms, as well as the treatment. So until next time, have a great day.